So greetings, friends and followers. This is Nurses Talking. I am Del Barzi. As always, if you like what you see and hear, subscribe, leave us a comment, let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students through retirees and anywhere in between. Today, I am very, very pleased to welcome Brianna Dawson. Brianna is board certified psychiatric nurse practitioner, and she's the owner of Behavioral Wellness for Women with a mission to provide compassionate, holistic mental health care to women throughout the perinatal period and beyond. And she says her personal philosophy is that each person deserves individualized care that considers the whole person. So, welcome, Brianna. So tell me, why are you a nurse?
Yeah, so I've always wanted to be a nurse, like since I was like 9 years old. I knew I wanted to help people, and I don't really know what exactly led me to wanting to work in the medical field, but I would always go on to like the Discovery Channel or the I think it was the Discovery Network, and watch like people giving birth and things like that, and it always like intrigued me. So that's kind of where it started, and I knew I wanted to help people, so I decided I wanted to be a nurse and went straight for that once
Yeah.
I graduated high school.
Yeah, and it sounds like even then you knew you wanted to be involved with the birth process because you were looking at people giving birth and all of that.
That's crazy. Yeah, I thought I would end up being like in maternity, like working in maternity, but it ended up working that way in a different way, right? From the
Yeah,
mental health side, which is kind of crazy.
that's cool. So you always wanted to do this, and right, that brings two questions to mind. One, um, when you got to it, was it what you thought?
Oh, that's a good question. So my first job was actually at a nursing home. And I don't think it was what I thought it would be. I think that, not to jump right into the negatives, but I think that it lacked a lot of support,
Mhm.
especially as a new graduate nurse.
Uh-huh.
And it was a lot more, I think, mentally challenging and physically challenging in a lot of ways. But I'm also grateful for, the way that I came into nursing, because I just kind of learned as I went. So it was definitely a learning curve and a learning experience, and kind of like, um, yeah, yeah,
Yeah,
trying to lean on different supports, but it
yeah.
worked.
Yeah. I think I understand what you're saying about the lack of support there because I think gerontology is presented to us in a kind of many people still have this notion of it as a custodial thing
Exactly.
rather than an
Yeah.
actual, yeah. So yeah, I get that.
I just remember having a lot of patience, and then like having to move so fast to push the medications. Yeah.
Yeah, I got you.
Yeah.
So
Some medicines had to be crushed and some had to be given different ways through a tube and whatnot. So
and all sorts of things and all sorts of things. So what kind of other areas did you work though?
So after I worked at the nursing home, I went straight into behavioral health. So when I was in undergrad for nursing, getting my bachelor's, I really loved the psych rotation. So I always loved psychiatry. I always found
Okay.
it interesting. And so when I was working at the nursing home, I was like, let me see if I like it in real life. So I applied to a job per diem. At this inpatient psychiatric hospital for children, and I loved it and I never looked back. So I from then on I worked in a lot of the different inpatient psychiatric facilities in the greater Philadelphia area.
Yeah. So then why perinatal?
Yeah, so perinatal mental health literally fell into my lap. So when I decided that I wanted to have more autonomy in my work, I decided to go back to school, and get my master's to become a psychiatric nurse practitioner. And when I was looking for my first job, I found a place that was focused on women in the outpatient setting.
Uh-huh.
And I was like, oh my God, I didn't know that I could like just work with women. Like I knew that I had always had like a passion for women. But I didn't know that I could just work with women. So I was like, oh, let me look into this. And I started working there, and yeah, like my eyes were opened, and I didn't even know, like they didn't teach you that in school or anything about perinatal mental health. I didn't even know that that was a subspecialty that existed.
Mhm. I was about to say that, often as providers and as consumers, I don't think we know just how much there is regarding perinatal. It seems to me there's a lot of misunderstanding about the perinatal period
Yeah.
and what the issues are and can be and stuff like that. So yeah, your
Yeah.
specialty is cool.
Yeah, I love it. I love it so much. And I love seeing women's mental health improve and them being more connected with their babies and their families, through
Yeah,
medication management and whatever other resources like therapy that they utilize.
yeah, yeah. And I feel that you said you so during the perinatal period and more.
Yeah.
What that said to me was that for us, I think many of us consider the perinatal period a very short one, but is it?
Yeah, so that's a good question. So, any like perinatal mental health diagnosis, so whether it's anxiety, depression, or any of the in between, it typically textbook lasts, up to a year in the postpartum. But I mean, it could certainly last longer than that. And I think that mental health is a lifelong journey. So nothing just kind of like stops just because your textbook said
Right.
it stops at this time. Right.
Yeah, yeah, yeah. I think that we kind of see it like that, that we think, well, okay, so the kid is 2 years old. I mean, what's the issue now? You know, and it's not quite like that.
Right. Exactly. It's a
Mhm.
journey, and it never stops. So
Yeah.
needs might change and symptoms might change, but
But
it's a lifelong journey with mental health.
yeah, yeah. What you what would you like to see change in nursing?
So I'm curious. So do you mean from like a nurse's perspective or a nurse practitioner's perspective? I guess.
Oh, either. When I speak to nurses, we have a lot of things that we would like to see not be that way. I
Yeah.
really think that we just need to, I want people to just articulate for a start what we want to see change, because if we don't articulate it, we're not going to change it.
Right. Yeah. So like from the nurse's perspective, like working on inpatients in the inpatient setting, there's a lack of direct support. And it often leads to burnout. Also
Mm,
I've seen a lack of resources in the hospital setting. I think the thing that we need most as nurses is that extra support because it's easy to get burned out. And oftentimes I've seen the caseload just be like so high that it's so hard to give adequate care in those settings. And that kind of translates into the nurse practitioner world as well.
yeah,
Not so much in terms of supplies for me where I worked, but just with the caseloads, just kind of like with the mental health or not the mental health system, with the health system, the healthcare system. Um, as a whole, there's just like constantly like piling on more and more patients to kind of get more money. But
yeah. That's it.
yeah, it's not that healthy for the provider or the patient because they're not able to get adequate care, and then like the
Yeah,
providers are getting burnt out. So
yeah, yeah, yeah. I kind of hesitate to say this, but I've been saying it now for a little while, is that healthcare is, we're kind of modeling healthcare, like at the Ford Motor Company. We've got a conveyor belt and just
yep,
and,
exactly.
and
Exactly.
you know, and in the meantime, while we're doing that, we're talking about holistic care. And the two are not really compatible.
No, not at all. Because you don't have time to address the person as a whole, right?
Yeah,
It's kind
yeah,
of like, what are your symptoms here? You go fix it, put a band-aid on it, and then see you later type of thing in those
yeah,
settings. So
yeah, yeah, yeah. And so many of our consumers, despite the fact that we have all of this information at our fingertips, a lot of it is just confusing information anyway. But so many of our consumers come to us not even knowing what they would like to know, not even knowing what questions they want to ask or what they would like to know. And we don't have time to even give them a basic framework of where they are and where they could be, and, spark some questions in their mind.
Yeah.
Anyway, to say though, now that you have done, and I'm going to add so far to this. What would you say is your greatest achievement so far?
Yeah, so I would say my greatest achievement is starting my own private practice, behavioral wellness for women.
Yeah. What was that, a uphill kind of battle?
No, it wasn't. It just
No.
so it wasn't like necessarily an uphill battle. It was more so my mind, my own fears and anxieties about having my own business and what that would look like, and if patients would sign up with me, and finances and things like that, like the typical things that come with owning a
Mhm.
business. And then just like, yeah, my own self-confidence, because obviously I know I can do a good job. I'm working for another company, but I don't know, it kind of gets challenged when you decide to put yourself out there as an
Yeah,
individual.
yeah. So how long have you had this?
Yeah, so I started my private practice in February of this year, 2023. Yeah, so it's a baby turning 1 soon. I'm really excited about it.
I know, but I was about to say, as you said, February 2023, and I'm thinking to myself, I am almost certain, I don't know if you see it, but I'm almost certain that if you had the moment to just look back between here, we are 1st of December, and February, what your trajectory has been like.
Yeah. Yeah, it's
Yeah.
definitely, so the practice has definitely grown, over time. And yeah, even like the whole process from a business, like learning how to be a business owner and, like how to market, things like that has been definitely a learning curve. So
Yeah,
they
yeah,
don't teach
yeah.
you that in nursing school. So
No, because you know what? They're not trying to turn out people who want to be business owners, who want to be entrepreneurs, who want to be policy makers. And that's another thing. We really do have to change. One of the goals of this is that I want to change the view of nurses, because we really need to educate nurses to be those things, to be entrepreneurs, to be policymakers, to be, you know, whatever it is,
yeah,
because that nursing license gives you a license to be whatever you want to be. You just need to be.
there's so much you can do, as a nurse in business. So
Yes,
yeah.
yes. Absolutely never ending. Never ending. What would you say to someone who wants to be a nurse today?
I would say go for it. I would say go for it. I would say it doesn't matter what school you go to. Like things like that when you're like, I don't want to say when you're younger, I'm pretty young, but back in the day, things that I might have or other people might have gotten hung up on. It doesn't matter what school you go to, you're gonna have the license and you're gonna be able to do the same things that someone that went to like Harvard could do. So yeah, I would say just do it. Don't put too much thought into like worrying about the outcomes, but just like take that first step and apply and then just do the work as it comes. And then I would also say to speak up for yourself, and advocate for yourself and others, and to take care of your mental health as well.
Yeah, yeah, yeah. And I'm so glad you said speak up for yourself, because again, that is something that is not, I don't know. I'm gonna speak for way back when I became a nurse. And that is not something that was even, I don't even think thought about,
Yeah.
let alone spoken about. You were a cog in the wheel. As a matter of fact, as I'm fond of saying, I became a nurse in the United Kingdom in the mid 1970s, right? And as I will tell anyone, as a first year student nurse, there isn't any, at that time anyway, there was no form of life on planet Earth that was lower than you. Or at least that's how I felt.
Oh,
At
wow.
least that's how I felt. So Anyway, yeah, but nursing, despite all of that, I think it has been a great, 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 great profession. So there you go. What would you say, though? I have been noticing that I can recognize nurses without anyone telling me they're a nurse. I started to think, well, what is it that I am seeing? Because, it started to become a thing where I'm almost playing a game with myself, you know? And I started to wonder what was I seeing. And so I'm starting to ask people if you could describe what is the most essential quality for your nurse? What you see as the most essential quality of a nurse in one word? What would that word be?
That's funny because I prepared already for this. So I was gonna say patience, but I changed it. Well, just now in my head. So I was gonna say patience, but now I changed it to be caring.
Be caring. Okay.
Yeah. Because that's what
All
it's all
right.
about.
It
That's
is.
huge.
It
Yeah,
is. It is. It is what it's all about. And caring encompasses so much. If you
it does.
truly, honestly care, it encompasses so much.
And it
Yeah.
goes such a long way. And sometimes patients don't just need like whatever the physical thing that you're doing. And sometimes it's just for you to be there and present
Yeah. Yeah.
and to show
Yes.
empathy. So
Mm-hmm. Mm-hmm. Absolutely. Absolutely. And that goes way, way, way beyond any medication, or anything else for that matter.
yeah,
Yeah.
so true.
What do you do for self-care?
For self-care, what do I do for self-care? For self-care, sometimes I just lay on the couch and watch Real Housewives. I'll just be honest. So after like a long day of just like extending myself to
Mm,
others, listening to people's problems and providing them with solutions, it's just like, I need to just kind of like step back from all the things that I've been doing all day and just kind of like disconnect, to be honest, and
yeah.
recharge by just like tapping out. But if you want to know a more healthy option, um, I like to exercise, so I go to bar and that really it
Mhm,
really fuels me and keeps me going and helps me to just feel better overall, in terms of
mhm.
my health, physical and mental health.
Yeah. Yeah. Well, I would have to maybe chide you a little bit because vegging out is not an unhealthy option. It's just
Thank
an
you.
option.
Sometimes I feel like as a mental health professional, I'm like, oh, I can't say that I just like disconnect and like
No,
binge watch TV.
no, I could because I get it. I get it. There are days when I just veg out. Totally. The TV may be
Very
on,
therapeutic.
yes, but I don't really want anything that is going to challenge my brain. I just want the background stuff, and I can wake up, I can go to sleep, and I can wake up and still pick up where I left off, and
Exactly. Yep. Yes.
I haven't missed
Love that.
anything. Yeah. Enough for nothing, but I love those days, I have to tell you.
They're the best. They're the
I love,
best.
Mhm. Yeah. All right, so Brianna, before we go, is there any last word you'd like to leave us with?
Um, I would say put yourself first because I think especially as nurses, we tend to put others before ourselves and you can't fully be there for others if you're not taking care of yourself, right?
Yeah. Yeah.
Um, so that it's so deep that if you're just like constantly burning yourself out, extending yourself to others, that it's gonna all
Yeah.
run out. You're gonna be burned out, and you're not even
Yeah.
gonna be able to provide the best care that you can. So,
Hmm.
yeah,
Yeah. Yeah. And you literally lose sight of who you are in that process if you don't do that. You really do lose
definitely.
sight of you. Hmm.
Yep, you're kind of just like a rat on a wheel, and just
Yeah.
not experiencing life or
Mhm.
yourself, your feelings, and
I
what's
know.
going on internally.
Yeah. Gotcha. Yeah. That's absolutely the truth. Brianna, thank you so very, very, very much for this conversation. I can't tell you how much I appreciated it. Thank you.
Oh, no, thank you for having me. I really appreciate it.
My pleasure. My pleasure.